My name is Christian Balgobin. I'm the Executive Director of the Alumni Association for the College of Medicine. The main focus of the Alumni Association is to promote engagement with the current medical students and also deter from the debt that they're currently getting once they're in medical school. We give out about 15 different grants every year, $500,000 every single year towards the medical education of SUNY Downstate medical students. The first initial meeting that students have with me is during their orientation week. I introduce myself and I introduce the new president, which changes every year, of the Alumni Association, and we're usually on the third day of orientation week where we give them a brief overview. But the first time that they're given a face-to-face, one-on-one interaction with me is during their first mentoring program. And every first-year medical student gets involved in the mentoring program. We connect them with mentors on their intended specialties, but also their interest in research. We provide iPads for every first-year student. And the smiling faces really brings joy, and it sets a precedent for their interaction with us throughout the next 4 years of their medical journey. In my role, I do many different things. For example, I fundraise, I put on events, we host the annual alumni reunion.
"2020 is my 50th anniversary. I started medical school here in 1970, and I've stuck to it ever since then. This is a medical school and an institution where both the faculty and the students come from all over the world. So there's lots of languages, lots of opinions, lots of thoughts about how healthcare should be provided. So it's a very stimulating atmosphere."
I've met people who've been working, who have been in very different experiences straight out of college, people who have been doing research for a long time, people who have been part of, who have worked as journalists before in the public health sector. A lot of these experiences that I've noticed, you don't just learn from your professors, but you also learn from the students, your colleagues here.
The Alumni Association supports is the Brooklyn Free Clinic. And students take place in this. They have to apply for the program, but it's a volunteer opportunity for students to interact with the community members. This is through helping folks who are seeking asylum. This is through helping people who do not have health insurance. This is through providing them with legal and also medical advice on how to best promote their health.
I would say the most rewarding part of being a member of the BFC is working with the patients that we have. They're very grateful for our time, and especially as medical students, when we're just beginning our training, it's really lovely to see your efforts and the knowledge that you've built over the past few years really come to fruition in a way that really helps your patients.
A student that came to Downstate only knowing one language and left Downstate speaking 3 because of the Brooklyn Free Clinic. He learned the community and really understood the need of understanding where these folks were coming from. So he learned Creole for the vacation population that we deal with. He learned Spanish for the immigrant population that we also serve. And he also learned a little bit of French for the folks who the Creole wasn't the best. So this is a student that has put and exemplified what SUNY Downstate is about, and the community is what we're here to serve. And he's now doing his residency in Chicago and writes back to check in and see how other medical students are doing and see how he can be a mentor to current medical students.
Living in Brooklyn and being at SUNY Downstate, we realized that this is a microcosm of the world itself. So by actually serving patients in this area, we are serving a global community as well. So I was working in public health before I decided to leave my job and do a post-bac and enter medicine. I was helping people who made too much money to qualify for Medicaid but not enough to pay for private insurance get access to healthcare. And I realized I didn't want to just help people get that access to healthcare, I wanted to provide the healthcare myself. So I interact with the Alumni Association via Med Council. I'm the class president for my class of 2022. So I interact with them to help fund student endeavors. Maybe when students are presenting at conferences, I interact with them for that. And just try to foster a better relationship between the students and the alumni. As you know, doctors, future doctors, do need to know other doctors, and any questions that they might have, we can put them in contact with the alumni office so they can get those questions answered.
We fund up to usually 25 to 30 students every single year to attend conferences all over the globe.
There is a process in place to submit an application, and there's a lot of guidance that I found early on. But there's always opportunities, especially now that I'd like to do research, and there has been some opportunities to go abroad and present.
Any place you go in this country and you look at the academic medical centers, you will find people who've graduated, physicians who've graduated from the Downstate Medical Center. Downstate is probably fourth if you look at medical schools who've graduated leaders in academic medicine around the country. It's an aspect we're very proud of.
If you have a residency interview in California, come speak to us. We can help support that, or we can find you a host in a different state, or even you want to do research internationally, we connect you with some of our alumni in Europe. The Alumni Association connects the world with Downstate.